Hi, welcome to Dr. Ties, your medical expertise here. Please note that this is purely for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today's topic is cold sore or oral herpes and how this can be treated. Cold sore is common and is caused by herpes virus, more precisely Herpes Simplex Virus Type 1 or HSV Type 1. These sores usually clear up without any treatment within 10 to 14 days. Cold sores or oral herpes can appear on the lips, front of the tongue, gums, inside of the cheeks, throat and roof of the mouth. Rarely cold sores can occur on the chin and neck. A cold sore usually starts with symptoms of tingling, itching and burning sensation. One or more painful blisters usually appear over the next 48 hours. The incubation period or the time to develop symptoms after an exposure for oral herpes is 2 to 12 days, although this can be a little longer in some people. Most people are exposed to oral herpes virus when they are children through skin-to-skin contact with someone who has a cold sore. This virus stays in the body for life once someone has been infected with it. It is more common to get flare-ups of cold sores when the immune system is down, when there are other infections such as a cold or flu, during times of stress and anxiety, with poor diet, in the sun and sunbeds, and during periods. Cold sore or oral herpes is typically transmitted by oral-to-oral contact such as kissing and skin contact with an active sore. Cold sores are considered contagious from the moment the first signs of infection appear to when the sores have completely healed. Oral herpes or HSV type 1 can cause genital herpes as well as cold sores. It is recommended to avoid oral sex until the cold sore has completely healed as it can cause genital herpes in the partner. It is advised to avoid kissing anyone while there are active cold sores. Hands should be washed thoroughly with soap and water after touching a cold sore. The treatment options for a cold sore are creams to reduce the pain, antiviral creams to speed up healing time, and cold sore patch to protect the skin. Over-the-counter cold sore remedy called acyclovir or Zovirax, or docosanol 10% can be used to treat cold sores. Valtrex or valacyclovir can also be used to treat cold sores. This is a prescription-only medication. The cream should not be rubbed into the cold sore but rather dabbed on it instead. There are also electronic devices available at pharmacies that can treat cold sores with light or lasers. Antiviral creams can work better when applied at the first sign of cold sore appearing, and they may not always work effectively after sores have already appeared. It is recommended to use sunblock lip balm with sun protection factor or SPF 15 or more if outside in the sun. It is advised to drink plenty of fluids to avoid dehydration. Paracetamol can be used to alleviate the pain, burning or discomfort from cold sores. It is best to avoid acidic and salty food if these make cold sore worse. If the cold sore does not heal within 10 days, if the cold sore is very large or painful, if there are complications such as swollen gums or mouth sores, or if there is history of weak immunity, it is advised to consult a doctor in person. The doctor may prescribe oral antiviral medication to treat the cold sores.